Justice, I would say, because we need to catch up with years where women were, for different reasons, deprioritized in the healthcare equation. Till the mid-90s, women were not included in clinical trials. Till today, the investment in women's health is very much less and disproportionately lower than it is elsewhere. So I would say that recognizing first the gap, creating the awareness, and understanding that by collaboration, we will get there.
Welcome to the Health Beats podcast, brought to you by Abu Dhabi Global Healthcare Week. The Health Beats podcast series is your window into healthcare industry news making headlines and the role of Abu Dhabi and the UAE in unlocking global healthcare momentum. We give you insights on the future of the global healthcare sector and Abu Dhabi's contribution to it. I'm your host, Lara Satrakian, and in this week's episode, I'm joined by Rami Kusa, Associate Vice President at Organon MEDA, that means Middle East, Turkey, and Africa. Our conversation today is entitled Reshaping Women's Health, Bridging Gaps and Driving Innovation. Very interesting and important stuff. Rami, welcome to the podcast.
Thank you, Laura. Pleased to be here with you.
You are very committed personally and organizationally to this mission of innovating healthcare for women. Tell us a bit about how you think about prioritizing and amplifying women's voices in the development of healthcare solutions. What's missing now? How do you amplify their voices, their needs? Tell us just about that gap and how we close it.
Indeed, yes, right you are. We're very committed to this mission and purpose of having a better and healthier day for every woman. That being said, because we do definitely recognize and know the fact that women are half the society, but in reality, they make much bigger impact than just the half. They take around the majority of the decision when it comes to healthcare in the families and in basically the society overall. That being said, we also know that for many years, women's health was deprioritized, whether because of lack of inclusion of women in the clinical studies till the 90s, or due to the lack of investment in women's health, or even to narrowing the definition of women's health to be confined to the reproductive health. In Organon, we realize all of these gaps, we acknowledge them, but we're also very determined to take them forward. So we first listen to the women, understand their needs, advocate for the fact that we need really to revolutionize the women's health care and getting broader to every woman when it comes to access of medicine.
And what are the major gaps that you hear when you listen to these women? What are the unmet needs in women's health? What are we not achieving right now? What's been overlooked or underfunded?
So, generally speaking, there are variety of diseases and issues that are related to women's health, not only affecting women, but sometimes disproportionately affecting women or even affecting women differently. These include not only the reproductive system, but diseases like celiac disease, migraine, lupus, osteoporosis, many conditions that are very much understudied, and we have lack of data when it comes to how it affects women. As an example, in Organon, we recognize the fact that heart disease and heart attacks do manifest themselves very differently if you compare a man to a woman. The typical chest pain that you see with a man is not necessarily the same manifestation that you can see in a woman. An example for this, that it can be coming like a jaw pain or maybe a nausea or something like this. This is why we try to advocate and raise this awareness around trying to reduce the misdiagnosis, trying to get to the right diagnosis fairly quicker before moving with different specialties and before getting to different conclusions that may not be the accurate ones.
And how do we fix these gaps? And I want to think about it together in two ways. Both, how do you mobilize investment in research and development for better solutions, better care, better communication, awareness of symptoms, but also just generally, what needs to happen systemically for women's symptoms, for women's different manifestations of health issues to be frankly, treated as equally as men's.
One step back, and unfortunately, we do recognize also the fact that only the investment when it comes to understanding women's health and women's related diseases is 1%, aside of oncology. 1% of the investment is directed to this cause. So, first of all, we would very much try to work with the whole ecosystem between policymakers, regulators, investors, pharmaceutical and research bodies, as well as scientific societies, to try to highlight the need first, understanding that this is an issue that, as I said, it's not only affecting half the society, it affects the whole society and probably economies as well. A healthy woman means a healthy family, and a healthy family means a healthy city and nation, and probably an economy as well. So with this, we're trying to collaborate with all the stakeholders in the ecosystem to highlight the areas of gaps and needs. First, we listen to the women themselves who know better than anyone on what they're facing, but also we try to simplify their access to medicine. We try to simplify their journey to access to healthcare. Example, as one of many, we're very much advocating to develop women's health care clinics, one place where the whole 360 degrees of women health is addressed in one place, and does not necessitate the need for a woman patient to just hop between the different specialties, different hospitals, different accounts, and so on. That's one of the examples when it comes to the care itself. But also when it comes to finding solutions and including digitalizing solutions as well, we try to collaborate with the non-traditional, I would say, stakeholders. And in this case, I would love to highlight our collaboration since launch with Flat Six Labs, which are a seed and early stage venture capital firm, the largest in Middle East and North Africa, where we collaborate with them to try to find young entrepreneurs who are very much interested in finding solutions for women health, whether in a Femtech way or different ways, where we basically try to enable those young entrepreneurs and try to let their solutions see light. This year alone, we're already collaborating with around 15 different entrepreneurs across the Middle East and Africa for this cause.
And what kind of things are they doing?
Lots of variety of stuff. So from awareness, from tracking, from maternal health, from women's health, from even tracking the fulfillment and persistence of taking their medicine, for online diagnosis, linking all of these together. Lots of solutions, but they're all addressing our North Star, which is getting a healthier woman by the end of the day.
That's very exciting. It also feels like a massive opportunity from a societal level, from a governmental level. Women being underserved means that the opportunities for gains in preventive care or productivity, population well-being should be substantial, no?
100%. And I'm very happy to be here talking from UAE, which also we've seen the first women health care strategy being developed last year and being invested in. We've seen also in lots of forums how the intention and the determination of really getting this topic to the forefront of topics.
Aside from these very promising early stage entrepreneurs you just told us about, what are some of the most exciting emerging technologies that you've seen that address the gaps that support women's health, whether it's innovation in reproductive health, maternal care, women's cancers? What's the frontier of tech as applied to this problem?
There's many, and I think I'm very happy to see this topic gaining a bit of traction. But to me personally, I'm very much, I would say, passionate about a device that reduces postpartum bleeding. So women, when they go to delivery, and sometimes, unfortunately, they do face an unexpected hemorrhage, unexpected excessive bleeding. I'm very much, I would say, passionate about the device that does stop this bleeding in less than 2 minutes. That means that the mother is not kept in the emergency room for 2 days, not being able to connect sooner than later with her newborn, making this connection and enjoy the happiness of the new birth. That's a very small, I would say, last step, but I think it makes a big difference in the mothers when they receive their first child or one of their children.
Anything else in the AI tech that you're seeing that's specifically addressing women's health?
Yes. Other than this, we're very embarking on trying to understand diseases that are very much, I would say, understudied. Endometriosis is affecting women across the world. We also try to very much see some understanding of research around the menopause, whether it's premenopause, perimenopause, postmenopause, understanding these, offering the help around those. We're also embarking on some other areas, as I just probably mentioned, stuff related to migraine, osteoporosis, lupus, and then celiac disease, and many others as well.
Fascinating. You mentioned Femtech. Tell us a bit more about that. We can probably guess that it's female technology, but tell us about Femtech, digital solutions. Tell us about this field as a whole. And is this something that's really intersecting with your work quite a bit? Where's the understanding that we need to grasp?
Yes, it's feminine technology, which is related to healthcare. And we do, like many of, I think, all of us understand and realize the importance that digital is getting day by day in our lives. Since our first day of launch 2 years ago, we recognized this. And this is why we basically dedicated some of our resources and investment to enable these solutions to see light, especially if it's coming from an early seed and an early investing, early stage entrepreneurs. We do see not necessarily it's our main part of the business, but we do see the intersection with what we're trying to do. We do see enabling these solutions will make on ultimately to bring health and health access closer to every woman. We know that the challenges that may be sometimes culture, sometimes access, or just sometimes the day-to-day responsibility of a woman, where it makes her deprioritize herself from getting the frequent checkups or maybe the frequent consultation and the right level of care. So by enabling these, and this can be a variety and not necessarily owned by Organon, but just we're trying to enable the ecosystem to empower women to make the right decisions about their own health, and empowered women able to make her decision about her own health will definitely lead to what we aim for is a healthier society.
This is a giant point. You're making a giant point that it's technology and it's psychology. And so for the messaging and the awareness piece and nudging women's behavior change to take better care and not deprioritize themselves when there are kids and there are jobs and there are husbands and everything and all kinds of obligations. So just curious, have you guys found a way to convince women to do this better? I mean, what insights from this behavior change and awareness raising piece? Because at the end of the day, that's so crucial.
I would say to a large extent we had good strides on this. So where we started and where we find ourselves today, I think a good progress. We started seeing in the Middle East the first holistic women's health clinics being funded. In the Gulf, we have at least 2 or 3. Lebanon recently, another one. And we started to see more of tailwind and many supporters to try to make this happen. Of course, it starts with a woman herself. And I think just by raising the awareness on how when she is good, her family is good. And I think we all saw this 2 or 3 years ago when we faced the COVID-19. We saw how the woman played a very different roles in house, and when only if the house and the home, the woman was healthy, I think the full family was operating in a good way. So I think this past experience, although it's not very positive with the COVID, but I think it enabled us significantly to get more supporters and more advocates in the ecosystem to enable things moving forward.
You have these very clear and strategic goals for women's health. So, how do you drive collaboration across research, healthcare providers, policymakers, industry partners to drive that success toward a chosen goal, more effective, inclusive innovation in women's health? That's sort of the big category, but you have these specific you've mentioned osteoporosis, heart health. So how do you really mobilize? And it's complicated. It's not, these are many moving pieces.
It's complicated, but the answer is in one word: is the purpose. And I think all of the stakeholders you just mentioned are very much willing to go for this purpose. We fully understand the need for this. We fully get how, from different angles, whether it being policy making, be it regulatory, being development, access, healthcare, even commercialization. I think the end goal here of the North Star is a one that we're all in common are looking for. That being said, it always drives our discussions. When we get a little bit of conflicts here and there, we do step back, realize what our vision, our mission, what we're trying to achieve together, and then all the roadblocks are being removed. We try to overcome them. It's not that easy, but I would say with the progress we're seeing today, it's very much promising that we're in the right direction.
But very much, I mean, in terms of the mechanics, how do you decide who's doing what, who's carrying which part of the load? How do you manage all of these collaborations to actually make progress and collectively step forward?
So, healthcare is a mature uh, segment, and it's been there since ages. So, I think the specialized part of each part of the process is very clear. The thing is how to synergize these efforts in one direction. So I think the regulator is clear. We have a very mature regulatory system that fully gets what needs to be done with the right processes, the policymakers as well. And I just referred to developing a women's health strategy in the UAE is phenomenal. And I'm sure that many other countries will follow suit soon. Same goes when it comes to the early stage research and development or innovation when we talked about digital and Femtech. I think it just each player in their own sector, they do exactly know what it's needed to be done. Our role here is to coordinate, collaborate, and align our vision towards this common goal and think basically our efforts because to reach faster than where we are supposed to go.
You focus on the Middle East. I focus on the Middle East. It's a very specific cultural context, one that we love dearly. But how do you ensure that these innovations that are being forged are sensitive to culture, to diverse views, and essentially are accessible by being culturally sensitive, are more accessible to women in our region in particular?
100%. And this is exactly my role is. I'm being the advocate and the ambassador and sometimes the platform, the stage where we try to highlight the common and also the commonalities and the differences when it relates to women's health in this part of the world versus the rest of the world. I think it's very important for us in the Middle East to open up, to be vocal, to open the dialogue, to listen to her challenges, her aspirations. And from there, we play the role from the Middle East, I would say, chapter here in Organon to advocate for this, to flag what do we need and how we can shape as well the healthcare outlook for women in the Middle East and Africa.
Interesting. So being that branch of a multinational is your opportunity to sensitize the global innovation drive toward
Yes, but being
regional
very much
solutions.
active and vocal as well. So being able to listen to our regional stakeholders here, being able to extend our ears, hearts, and arms to listen to the different parts of the ecosystem, including the women in the core of what we do, is a big enabler for us to get this. And from here, we take it to the global, I would say, the headquarters, and make sure that the newer strategies and the directions are very much taking into account the Middle East voice.
Outside of Organon, what do you think individuals, communities, advocacy groups should be doing to drive awareness and to, frankly, demand better care for women's health?
Justice, I would say, because we need to catch up with years where women were, for different reasons, deprioritized in the healthcare equation. Till the mid 90s, women were not included in clinical trials. Till today, the investment in women's health is very much less and disproportionately lower than it is elsewhere. So I would say that recognizing first the gap, creating the awareness, and understanding that by collaboration, we will get there. It's not by competition. And I think, again, probably I alluded to this, that the purpose aligns us and gets us around this topic, and it makes it easier to get there. So I don't think patient groups versus pharma versus regulators, policymakers, innovators, social, even media do have different agendas. They just have the same, I would say, goal at the end of the day. We're just trying to align these together and drive the cause forward.
We just had an incredible first edition of Abu Dhabi Global Healthcare Week in May. Next year's edition, 2025, is coming up. What are some of the topics or areas of discussion that you would recommend prioritizing when it comes to putting women's healthcare innovation on the agenda for Abu Dhabi Global Healthcare Week 2025?
So I very much echo what you said, that the kickoff was incredible and very positive. And for me, as someone who's assigned with the topic of advancing women's health in this part of the world on behalf of Organon, I was very pleased and happy to see the different stakeholders and the true makers of change are gathered in one place in 2024 edition. I would very much love to see in 2025 the the dialogue moving forward, making sure to see and track the progress since our very first edition, and to better, I would say, include and discuss topics that are, as I said, affecting women, disproportionately affecting women, or just affecting women differently. I think the more these comes to the agenda and the platform in such a big, probably the biggest stage in the Middle East now for healthcare, I'm sure that it will help a lot to enable a healthier and a better day for every woman.
Give us some themes. If you had a day that you could program talking about women's health, what would you most be just passionate about seeing in the mix of conversations?
Again, redefining women and women health, redefining the need based on low to middle income countries versus first world and first development countries, understanding the emerging themes of women's health that are very much overlooked. Some of them are overlooked. How can we drive investment? Need to show a bit of more of economical studies and confirmation that are related to this part of the world, to show how a nation can be in a better welfare from an economy perspective, from stability perspective, and future looking perspective when its women are in good shape.
What do you think is going to be the biggest challenge facing the future of healthcare, particularly in the realm of women's health? And that's also helpful for us to keep in mind ahead of Abu Dhabi Global Healthcare Week 2025. But really, what do you see as, I'll give you a little space, not just the biggest challenge, but some of the biggest challenges. You can pick more than one.
In my view, it will remain to be that the cost of innovation is very high. And accordingly, it becomes the access to medicine is become challenging. So how can we provide affordable solutions, innovative solutions, while breaking the glass ceiling of just of certain areas that we are not able to address? So what I understand that not necessarily from the beginning, certain areas and certain diseases that are affecting women will be very attractive from a commercial perspective. But I would say on a mid to longer term, it will be very attractive from economy perspective and welfare of a society and the government. So it will be a challenge how to prioritize this relatively smaller opportunity versus some of the opportunities that we've been for years thinking of the biggest, or they're being groomed to be the biggest. How can we start unlocking and unleashing this topic of women's health that we understand it's a very strategic, critical priority, not for a single segment of the ecosystem, but from the holistic ecosystem of healthcare.
So it sounds like two challenges baked into one, driving investment into all of these areas of need for women that are not being currently served, some of them more lucrative, some of them less lucrative. And then it sounds like a second one you've tagged, which is the affordability of innovation, of care for women who want the latest and greatest that's being developed, but can't necessarily access it from a cost basis. Is that a fair summary?
Very fair summary. Thank you, Lara.
Well, Rami, this was fascinating and so important. Thank you very much for joining us.
Likewise, thank you for having us with you, and looking forward to 2025 edition. Thank you.
Thank you for listening to this episode of the Health Beats podcast. For more healthcare industry news, visit the Abu Dhabi Global Healthcare Week newsletter. The link is in our bio. Thanks for listening. Like, subscribe, and continue to follow Health Beats by Abu Dhabi Global Healthcare Week for your global healthcare industry digest.